Joo-Yong Hahn and Mike Gibson join you live from ACC 2023, and we are talking about the RENOVATE complex PCI study using intravascular imaging versus angiography to guide a complex PCI. So tell us what you did and what you found.
Previous trials have consistently showed a lower rate of clinical events after IVUS-guided PCI compared with after angiography-guided PCI. However, none of these have been considered to be definitive, owing to the inadequate sample size, especially for the evaluation of the hard clinical endpoints. Relatively short-term follow-up duration and the inclusion of a highly selective coronary subset. Therefore, we conducted the RENOVATE complex PCI to investigate whether intravascular imaging guided PCI would improve clinical outcomes compared with angiography guided PCI in patients with complex coronary lesions.
And what did you find?
This study was a prospective, multi-center, open-label trial conducted at the 20 centers of the Republic of Korea. And we enrolled more than 1,600 patients with complex coronary lesions, and the patients were randomly assigned in a 2-to-1 fashion, either to undergo intravascular imaging guided PCI or undergo angiography guided PCI. In the intravascular imaging PCI group, the choice between IVUS or OCT were at the operator's discretion. Median follow-up was 2.1 years, and the intravascular imaging guided PCI reduced a rate of primary endpoint, a composite of death from cardiac causes, target vessel myocardial infarction, and clinically driven TVR compared with angiography-guided PCI. The incidence of safety procedure-related events were not significantly different between the two groups.
And how about death and MI? Not target vessel revascularization. Was there a difference in death and MI?
Yeah, the major difference in the primary endpoint is due to reduction in cardiovascular cardiac death or target vessel MI, and numerically the incidence of TVR was lower in the intravascular imaging guided PCI than angiography guided PCI, but the statistical significance was not found for the TVR.
Wow, so it was the hard endpoints of death and MI that were more reduced. That's very interesting.
Yeah, that's our very one of the striking findings, even to the investigators. So, when we excluded the procedure-related MI, the results were still consistent.
I see. So has practice now changed in Korea? Will this change practice in Korea? Will everyone be doing IVUS or OCT guided PCI?
No, not yet. And I would like to stress that we exclusively enrolled the patients with the complex coronary artery lesions. So I do not claim we should do intravascular imaging, IVUS or OCT in all comers, but intravascular imaging should be considered in patients with the complex coronary artery lesions.
And what counted as complex? What is complex?
Yeah, complex coronary lesions included left main, CTO, diffuse long lesion, longer than 38 millimeter, and the bifurcation lesions, and the severe calcified lesions, and etc.
Okay. All right. So for those lesions, this is yet another study that shows that IVUS and OCT guidance is probably superior to angiography alone. Okay. Well, thank you, Dr. Hahn. very big study, large number of patients, and clear results. Thank you for sharing with us. And thanks to all of you from ACC 2023 for joining us.